Thank you, Chair Sanders. I'm a doctor, and I worked for a long time with people who had chronic fatigue syndrome or other things which were just difficult to put your finger on. This is my problem. And the frustration they had with real symptoms but without real test findings was just remarkable. And so when I hear of long COVID, you have not my sympathy, my empathy. My understanding that this is something which can be devastating for someone. They feel like there's something out of their control dictating their life. And so I thank you for being here. I thank you for sharing your story. And for the researchers, I thank you for doing that research. Some of what I say will just be an echo of that which Senator Sanders says, because the facts are the facts. You know, most folks with COVID recover, but there is this subset which does not. And again, thank you for representing them. And we know that long COVID sometimes ends. That's the hope there, that there is not necessarily perpetual long COVID, but for some it is. And again, that is a challenge that we have before us. So let's get the research better. Let's do what we can so that those who have it, somehow it does end. By the way, my own kind of episode of it is that after having COVID, I could really smell ammonia. And I'd walk into a hospital where they were using it to clean a place, and whoa, it just powered me. I hope you don't mind me saying this, but when my dog urinated, I could really smell that urine. It was just something that was just so acute. But fortunately, that has kind of waned away, and now it's much less than it used to be. But it still comes back as just a reminder, and that reminder tells me of that which you who have these symptoms more severely, just how you might experience that. So what are we doing? Well, Congress, I'm glad to say, has put significant funding towards this. We gave the Department of Health and Human Services $1 billion to study long COVID. And last summer, this committee included a policy that would give further direction to HHS's long COVID research as part of the Pandemic and All Hazards Preparedness Act, which we call PAPA, the reauthorization. Now, we know, we're about to hear, NIH has received criticism about the effectiveness of their long COVID research program. The Researching COVID to Enhance Recovery, or the RECOVER initiative, and that's why Congress needs to reauthorize PAPA. That gives us the ability to give not just money, but oversight as to how these programs are being conducted. Today, we're going to hear from some of our non-federal partners working on RECOVER and other HHS-funded projects to better understand how that work is going, what opportunities are there, what else can Congress do. And we're also going to hear from patients and from the mother of a patient as regards your about your long COVID experience, and allowing that to illuminate the conversations that we'll be having. I thank you for being here. I thank the committee for examining it. And Mr. Chairman, I yield back.